Hi, this video is the demonstration of the FUE donor scar after many years follow-up, and he had 2 FUE done in the past, and the scar is there, but it's hard to see. And the FUE there's always pro and con for both, and I perform both FUE and FUT. Both FUE and FUT leave scar, but the FUE scar is dots and small and scattered that it's hard to see, and this is shaved with a clipper without a gar. And so not just less visible scar, less invasive, less bleeding, less chance of infection, heal faster. But the downside of the benefit of the downside of the FUE are it's more expensive than the strip method. The number of grafts we can do is less, 25 to 3,000 grafts per day. Although there are days I can go beyond 3,000. The FUE, you can have excellent density and result with FUE or FUT. However, if you compare my FUE to my FUT, the growth rate is 5 to 10% less density than my FUT. But if you compare my FUE to other doctor, whether it's FUE or FUT, my density is still better. And again, it's really dependent on the surgical skill of the surgeon. On the other hand, the FUT or the strip method, there's pro and con. The FUT will leave you a linear scar and permanent for the rest of your life. You can wear your hair shorter. The FUT will have to cut you open, so that means more invasive, more painful during recovery, more bleeding, more chance of infection. But the benefit of the FUT is cheaper than the FUE. The number of grafts we can do is more. We can do 4,000 to 6,000 grafts per day, and it's very effective for advanced hair loss. And the FUT growth rate is 5 to 10% better density than the FUE. Again, I perform both FUE and FUT. This video is the demonstration of the FUE donor scar multiple years after 2 FUE surgery. Thank you.